Communication, Improving Self-Efficacy in Mock Codes by Ryan O'Leary. Terminal learning objectives. These are the objectives that are the broad, overarching objectives we want our participants to achieve. Number 1, participants will effectively communicate during a mock code. Number 2, participants can assess cardiac rhythms on assessment. Enabling learning objectives. These are the more specific learning objectives that will enable the participants to reach the overall overarching terminal learning objectives. Number 1, explain how to use night communication. Demonstrate closed-loop communication during a mock code. Compare how night communication is associated with closed-loop communication. Identify 5 cardiac rhythms with their respective interventions. Learning environment. The classroom setting will be within the Tripler Army Medical Center's emergency department. There will be 2 areas for instruction, one as a conference room with the projector, and the other is within a closed-off pit/area that has a scheduled daily downtime from 06 to 11 a.m. Students will have internet access with the conference room as the projector is hooked up directly to the internet. The patient rooms where the mock code will occur will have no internet access via cell phone. However, the participants will have access to all other technology typically found within TAMC's emergency department used in patient care. Now, these rooms are not closed off areas, so there will be patients and staff moving on the perimeter of the working area. However, there is typically a very low census during the morning hours when the simulation would occur. The noises during this time may affect the participants' experience. The pictures above show one of our open bay rooms and the equipment surrounding it on the left-hand side. The crash cart on the right-hand side is the typical configuration found within the emergency department at TAMC. There are 3 carts located throughout the department, 1 per pit. There is a training cart that will be utilized so that our emergency crash carts will not be used in the event of an actual emergency. Simulation preparation. Participants will be given pre-simulation education materials to prepare for the exercise. A mock code simulation video will be given for participants to watch prior to arrival of the exercise day. This video will be for participants to see what right looks like, hopefully building confidence. Once the participants show up to the conference room within TAMC ER, they will all be given a different EKG rhythm. Each member will have to identify the rhythm and identify the necessary treatments. This exercise will allow critical thinking to take place in a safe environment prior to the start of the exercise. Any questions would be answered by the facilitator. Night communication. NIGHT stands for name, information, tone, and expression. Point Guard College is a national basketball training program that develops varsity high school basketball players to get ready for college basketball. At this program, I was taught about night communication and how to utilize the technique with teammates, coaches, referees, and anyone else in life. Our body language is contagious. What we say when things go wrong, the tone in which we say it, and how we express those feelings through body language has a huge impact on the team dynamic. For example, looking at any one of the major professional sports, watch a game closely after a bad call has been made. Does the team captain throw his hands in the air and yell? If they did, you'll quickly notice those around him that they would probably be doing the same thing. However, if the captain gave the person who turned the ball over a high five, you'll see that that player has a positive attitude for the next play. This player now knows that the captain has his back and supports him even through mistakes. How we communicate with others dictates how well we succeed or fail in anything. In the hospital setting, these same principles apply. In a team-driven atmosphere, night communication is an important tool that can be used throughout nursing. In cardiac arrest, how well teammates communicate with each other determines patient outcomes. For this reason, night communication needs to be taught and practiced in the hospital setting. One example of this will be as followed. Steve, I saw you draw up adenosine when my patient was in SVT. She was able to convert back to normal sinus rhythm after vagal maneuvers, but I appreciate you looking out for me even though she wasn't your patient. During this example, I used Steve's name and provided him the information of what I saw. I did not yell during this encounter, nor did I show poor body language. I demonstrated my appreciation for his act by seeking him out to thank him. This kind of builds rapport within teammates and co-workers so that we'll be able to work together throughout the future. Closed-loop communication. Closed-loop communication is an important tool not only in cardiac arrest treatment but in nursing in general. The act of repeating the information provided back to the speaker demonstrates understanding of what they want at that specific time. For example, Stacy asks John, "John, prepare 1 milligram of epinephrine after an IV is placed." John immediately repeats, "Stacy, I will prepare 1 milligram of epinephrine after I place this IV." John demonstrates that he needs to prepare ALS medications for this patient and that the IV access is a major factor in providing those medications. Without closed-loop communication, the team leader will be talking out loud with no one either hearing them or no one will know who he's talking to. This demonstrates the importance of incorporating night communication during closed-loop communication. Using someone's name grabs their attention. In the military treatment facilities, we have a rank structure where officers are registered nurses, physicians, nurse practitioners, and physician assistants, to name a few. The enlisted soldiers are the combat medic personnel. Enlisted soldiers address officers as sir, as within military customs and courtesies. You can imagine a medic addressing someone as sir in the middle of a code, and you'll have multiple people looking at him or her while thinking that he's talking to you. Debrief. Following the mock code, the group will debrief. They'll debrief from preparation all the way through the simulation. Every portion from start to finish will be discussed. Debriefing is a crucial aspect of the learning process in any simulation or live event. This time is allocated to allow participants to reflect on what had transpired and to generate thought. By creating dialogue with one another, different perspectives can be seen from other participants. Lessons learned throughout the exercise will arise as well. Students will be able to verbalize these thoughts during the debrief, or they can conduct some post-exercise journaling to refer back to later in their career. Are there any questions?